Hey kiddos, I'm back. Part 3 of this series, Make It Make Sense Cardiology Edition. We are talking about the procedural treatments for atrial fibrillation. Again, if you have not reviewed parts 1 and part 2 of this series, I highly recommend that you do so, especially if you're a student nurse or a baby nurse, because this moving forward, what I'm about to discuss with you may be a little complicated, but it will make sense if you just review the previous parts. Ready? Lock in. Let's dive in. So we've already talked about medicinal approaches to the treatment of atrial fibrillation. We've talked about anticoagulation. We've talked about, what atrial fibrillation is and the problems that it presents. Now, if you have somebody who has recurrent, persistent atrial fibrillation, then procedures are likely going to be the mainstay of your treatment, or at least a significant topic of discussion for consideration. So there are 3 major procedures that are often utilized to help treat atrial fibrillation. The first is very, very common to a lot of us who work in the hospital, especially on like med-surg units. You're probably most familiar with the TEE guided cardioversion. TEE, that stands for transesophageal echocardiogram. So an echocardiogram is a basic ultrasound of the heart. Looks at general structure, general function, no differently than when a pregnant mama goes to get an ultrasound of her unborn baby. The doctor will put the gel on the belly and then rub the transducer in certain spots to pick up the heartbeat and to look at structures, make sure baby's got 5 fingers on each hand, 5 toes on each foot, whether or not it's a boy or it's a girl. General structure, general function. The echocardiogram is literally the same machine, but instead of looking at unborn baby parts, we're looking at cardiac structures. You're looking to see if the chambers squeeze and relax like they're supposed to, if the valves open and close like they're supposed to. You're looking at chamber dimensions. You're looking to see if there's any clots that have formed within the heart, not just in the left ventricle, but in the left atrial appendage or anywhere else for that matter. You need to do this transesophageal echocardiogram before contemplating a cardioversion if your patient with atrial fibrillation has not been on any form of blood thinner for at least 4 weeks uninterrupted. Okay? Because the last thing you want to do is purposely shock the heart. That is the cardioversion part. You don't want to purposely shock the heart without having investigated whether or not there are any blood clots in there. Because once you shock the heart's going to do one giant squeeze from all that electricity. And if there's a clot living in the heart somewhere, it's going to shoot right on out into circulation and go through the path of least resistance, the neck arteries, and go right on up to the brain to cause a stroke. Please do the TEE guided cardioversion safely. Okay, which every cardiologist I've ever worked with always does that safely. But nonetheless, that's one potential treatment method for the treatment of atrial fibrillation. Another treatment method, and these kind of run hand in hand, but I'm going to explain the difference. You have an ablation that can be done, or you can have a maze, M-A-Z-E, maze procedure done. Like I said, they're very similar, but they have their differences. The ablation is a minimally invasive procedure, very similar to like when the patients get a heart catheterization done. There's a tiny incision that's made in the groin area. Through that incision, a tube called a catheter is inserted and threaded all the way up to the heart. The rhythm in question, atrial fib, is then purposely induced so that the electrophysiologist can actually look at the map way, like the pattern of where this atrial fibrillation circuitry is going in the heart. They're doing that on purpose because they want to see like where the electrical pathway is going, because they're going to take a tool called it's a catheter ablation tool. They're going to take that tool and they're going to go to the targets of that electrical pathway, and they're going to burn those targets, okay? So that when that rhythm is induced, or you try to induce the atrial fibrillation again, once those target pathways are burned off, and that can be done by either cryoablation, or you can use a heat method also, tomato. The point is still the same. You burn off the target pathways of the abnormal rhythm, so that when the heart does give that electrical charge off, that charge has no choice but to go through its proper circuit. I can't talk. The heart has no choice but to send that electrical pathway down its appropriate circuit, and thereby restoring normal rhythm. That's the ablation. Now, the maze procedure is very similar in that the targets of the abnormal pathways are burned off also in sort of a zigzag pattern. That's why they call it a maze procedure. But this procedure is a lot more invasive, very similar to open heart surgery. But just know that the similarities between the two is that they burn off those extra pathways for electrical circuitry. For some people who are qualifying candidates, and this gets a little tricky, but nonetheless, you have a Watchman's procedure that can be done. Now, this doesn't do anything for the rhythm itself, the Watchman's procedure. What the Watchman's procedure is for is to close off that left atrial appendage. Remember that left atrial appendage is the place where blood clots can take up shop, can set up residence in the heart. Blood clots like to just congregate there. If you have somebody who is not an appropriate candidate for long-term blood thinners, then you may want to consider having them speak to the CT surgeon about maybe getting a appendage, left atrial appendage closure, which is a Watchman's procedure. Now, granted, once they're on the Watchman, or once they get the Watchman's procedure done, they're going to have to be on blood thinners for a very short period of time, 4 weeks or so. But in the long run, they're not going to have to take blood thinners for, years on end. Not at all. So take home point from today's post, and then I'm going to wrap it up, is for procedural treatments of atrial fibrillation, you've got your TEE guided cardioversion, you've got your ablation procedure that can be done, and you've got your maze procedure that can be done. Those take care of the rhythm, or help to eradicate the rhythm of AFib and restore normal sinus rhythm. And then you've got the Watchman's procedure that can be done to close off that left atrial appendage so that blood clots don't take up shop in the heart. And these are the patients who won't have to take blood thinners for the long haul. Got it? Y'all did good today. Very, very proud of you. That is going to conclude for today's lesson. Y'all have a wonderful day. I want to go grab myself a bite to eat. Later.